So our patient today is Bob. So let's thank Bob for coming in today and having this implant done, right?
Oh, there's some
Okay, so we had the advantage of numbing Bob up earlier this morning, about a half hour ago. So the area that we'll be working on here is tooth number 4, right in front of this crown here. So the first thing we're going to do is go ahead and measure this area to make sure that we have adequate width. Okay? We're going to use our calipers here. And Bob, you may feel some pressure, but do you have any discomfort there?
No.
Okay. So we go ahead and measure the ridge. And we have about 7 millimeters. So with 7 millimeters, we'll have about 1.5 millimeters on either side of that implant of bone. Good. And then I always will ask my assistant, how's my angulation?
That looks good.
We're good? Okay, so we're going to go ahead and get started. Good. So we're just using the high-speed handpiece just to peck through the cortical plate. That's all we're doing. So again, we're going to check the angulation. Right.
That looks good.
Okay, and if you open just a little bit for us, Bob. Good, here we go. So what we're going to do is peck away at the cortical plate. And at this point, Bob is just feeling vibration. Is that correct, Bob? Okay. We'll use our paralleling pin to see if we're on angle. Good. So I don't know if we can see that in the mirror there. So as everybody can see, we're right on center there. So because this looks good, we're going to go ahead and continue to the full osteotomy. So now we have this little sleeve that we're going to put on this guy so that we prepare to the proper depth. Perfect. Okay, so the next thing we're going to do is use a tissue punch. We want this to be atraumatic. We've already felt and we've got the width of bone, so we're going to use a tissue punch as compared to reflecting the flap. Okay, so now we're going to use a little curette to pop that little tissue tag off. Oh, forceps there. Thank you. So we're just going to take this little tissue tag out now. If you just try that for me, please, and we'll show the audience how nice that looks. Thank you. Perfect. If we take a look, we can see it's nice and clean now. So now we go to the final drill. With the TSI system, there's 2 drill sizes for a certain size of an implant. So a 4 millimeter implant has 2 sizes. 1 drill size that's made for the maxillary arch, and 1 drill size that's made for the mandibular arch. The reason for that is obviously because the maxillary bone is not as dense, so that osteotomy is going to be slightly smaller as compared to an osteotomy made for the mandibular arch. There's no bone tafts necessary for the system. That's how simple and effective it is. So we're going to go to the final drill. And this is what the final drill looks like. Now this is not an end cutting drill, it's only a side cutting drill. So we're going to follow the depth that we had with the initial pilot hole. Notice I'm using a pecking motion. We don't want to heat the bone. A good idea to do is look at the bone that's on the drill. Okay? If you see pink or white, that's good. If you start to see darker colors, that means you're burning the bone. We don't want that. Okay, we're ready for the implant. We're going to take it out of the sterile vial. Notice the threads and the auger tip. We're going to take that directly to the site. And we're going to start to turn until we get a little resistance. Do you feel a little pressure there, Bob? No? Okay, good. Now we're going to go with the driver. Now the kit comes with a finger driver or a driver that can go into your handpiece, whatever you're comfortable with. I like to use the finger driver so that I can feel the resistance personally and know exactly how this implant is being placed. Okay? So a couple turns here, and already I'm getting a little bit of resistance. So the beauty of this is it's a single stage implant. So for those of you who may be specialists, you can put the healing cap on, and there's no second surgery for your doctors that your referring doctors to do the prosthetic portion. So now I've gotten to a point where I can't turn it with my index finger and my thumb. So the next thing I want to do is incorporate the ratchet. So we're going to pop this off. You can just put that right into the ratchet. Okay, so if everybody can see, on the ratchet we do have a torque measurement. Let's see if I can put it this way. So we're going to take a look at the torque here in just a moment so that everyone can see. Okay? Okay, so we're going to go ahead and position that. We're already at about 30. Usually it's going to increase dramatically as soon as we get to that auger tip, that bullnose tip. Up to 40. Good, we're just going to go with a longer. So the final few turns. Perfect. So let's go ahead and wash that area. So if you take a look, we can see where it's at. Now, remember, this is a single stage implant. So the margin of this implant is going to be the margin of the crown. The axial wall of that abutment is going to act like the post. So what we want to do is probably sink that collar just a little bit more so that when he smiles we don't see a metal collar. A little bit more torque here. So if we take a little view here in the mirror, you can clearly see what's going on there. Okay? Placement of the implant.